let me thank the audience for a lively discussion that you have really made it great and asked a lot of questions about it. Most of the things, difficulties have already been covered. I'll be just briefly going through, is the femtolaser assisted cataract surgery still relevant for the Brunescent cataract? Of course, yes. Hard cataracts, they need to be cracked. As I said, they need a strategy. They need tools. And FLACS is one of the tools which comes very handy when you are handling these cases. As I had said earlier, that it is the first divide and the first fragment which is the most difficult. And these are the situations where FLACS comes to your rescue. That is, it makes sure that you are able to divide the nucleus into two halves, and even if it is a leathery, except for the posterior 500 micron, which is not cut with the laser, you have a divide in the cataract. Even if it is a very hard cataract, still FLACS will be able to cut. The only change that we will do in the settings is the number of passes. Normally, we'll have setting at 3 passes. That means the laser goes through the same point 3 times. But when we have a hard cataract, we'll make it 5 passes. That means the laser will go through the same plane 5 times, so that you have a little more separation or a clearer cut in between these. So now this is the FLACS starting. And if you see at this point, you already see the grayish area. You have a pointer? You already see at from 1 to 3 o'clock position, you see a whitish area coming. Now, this is very typically seen in hard cataracts. When you're doing FLACS and you see this kind of appearance, that means that this is a hard cataract, and you should be ready to change your plan or something for, yeah, this is the one. And if you see it, notice there are two. This is one and this is the second. Now, this is because because of the hardness, the only plane in which the gas bubbles can go is in between the laminae. So it will go both anteriorly, posteriorly, and give you a separation kind of a between the fibers also. So this takes care of your dividing the nucleus into, normally I'll do 6 fragments. I'll not go in for softening of the fragments, because if you do the softening of the fragments, then it's very difficult to hold this. So I'll make typically 4, 5 passes, 6 segments, and no softening to be done. This is another case FLACS being done. And again, you see that similar kind of a pattern appearing. This means that I have a hard cataract at hand. There was a mention about the posterior polar cataract and the dehiscence, if you have a pre-existing dehiscence. Now, these are the cases where FLACS becomes very handy. Once you do the scanning, you will be able to see the dehiscence in the posterior capsule, and you will change your plan accordingly. Now, this is going ahead with the surgery. Already we have seen very nice videos, but as was mentioned from the audience that debulking should be done, I would do debulking. This is important because already it's a hard nucleus, big nucleus. Bag is not much of a space in the bag to handle. So therefore, if you can debulk, it will be easier for you to separate the fragments and achieve a complete division between the fragment. And I'll try to go as deep as possible. One of the signs here which says that you should not go beyond this is if an air bubble comes. That means you are close to 500 microns, and that means you have separated most of it. Now, this is what is going to be again most important step. This is the first divide, and at this stage, make sure that you divide into 2 complete fragments like the my loop does. Don't leave it at something which is short from the center of the nucleus. Make sure that it goes beyond the nucleus. If you can divide into two halves, very good. Otherwise, at least you should achieve 80%, 70, 80% of the complete separation and see a good reflex which will make your job. Now, this is where I. So then you rotate it. And after that, your emphasis should be on the first fragment, because once you have removed the first fragment, then there is both lot of space, and then also when you are chopping, you have enough space to separate it completely, so that you have enough space to work and separate it completely. And try to remove the fragment completely. You don't leave the small pieces also, and you change the position of the tip, not to pull the fragment toward the tip, but to use the fluidic forces to whirl it around close to the tip, and use your chopper to block the movement of the fragments as they are moving in the anterior chamber. It is the hold which is more important than the force of the chopper. If you have a good hold, you will be able to remove it, and then you are able to remove the fragments, and in the end reduce the power. Now, one point that I would like to mention here is what I have experienced many times in these hard cases. These pieces are hard, and once there may be a longer fragment of the nucleus going through the lumen of your phaco-tip, and it may block the tubing, especially at a point where your tubing is going into the pump, or it is going into the cassette. So I would have a person, OT assistant, who has a torch and is there to watch if the fragments are getting blocked or not. If the fragment blocks, then it becomes difficult. Like I had a problem 2 days back, and I had to change the cassette again because it couldn't open. Or in between, once you have taken 2 or 3 fragments, just put the foot switch on without phaco power, so that the good amount of fluid goes out and it washes away whatever small fragments are there in the tubing. And this is how you complete it. This is another case. I'll first remove the epinucleus, and then I would like to debulk it, primarily to make a space for the first time. Try to go as deep as possible, but definitely go beyond the cuts in the middle. That is the central core. Please don't leave a part of the central core. Remove the central core, and your trench should go beyond the center where all the lens fibers are crossing each other. And once you have made the first chop, then it is easy to, and you have to push back the left half, because some of the fibers from the right part of this are still there. Once you have removed the first fragment, then becomes very easy. Like I tried, there was a small piece left, but I removed that before moving on to the second fragment. And after the first fragment is removed, you have enough space to slide the fragment a bit, which separates it from the cortex also, makes it free, and it makes it easier to be removed. And after that, it is just your patience and perseverance. Go slowly. Most of the battle has already been won. And then you remove the rest of the fragments, and then go ahead with the implantation of the lens. I would always, as you had seen, that when I'm removing the fragment first and second, I would like to push the cortex back and just remove the nucleus. I don't want the cortex also to come along with it. I would like to leave the support of the cortical plate for some time, or till all the fragments have been completely removed. And as was mentioned earlier, the fluidics of the needed machines are really good. This is our center. And with that, I thank you all, and we open to question and answers now. Any questions? Any questions, comments, any personal experiences, anything anyone would like to? So we had a good video presentations by Dr. Jagatram on how to crack the hardest ones, and very good discussion following that. And we had on a MyLoop presentation, which appears very convincing that there's no reason why one should not go into that. And if you have access to FLACS, it makes your life much easier. It makes your results more predictable. It reduces the risk of complications, and it gives you a clearer cornea in the immediate post-op period. So if there are no questions, shall we come to the end of this course? And thank you so much, everyone, for being with us on the first afternoon of the day. Thank you so much.